Computer. Hey, good morning, Philip.
Good morning, Matthew.
Are you doing well today?
I'm doing well. How are you
Excellent.
doing?
I'm doing all right. I'm waking up. I got my coffee. Coffee.
Nice, nice.
I got a special video for us today.
Oh yeah?
Yeah.
Do tell.
Well,
Give me a little bit of a slice of context before we dive into this. I don't want to be caught unawares.
have you ever heard of a Roman emperor named Caligula? No.
Blushed.
No. ADHD adjacent. Do you know Dr. Russell Barkley?
Um, I think so. But me, names and faces and recall being what they are.
Yeah, right
Uh,
on.
it's probably going to be more, oh, that guy when you start playing it.
Yeah, yeah.
But I'm pretty sure I know who you're talking about. I've heard some of his stuff, I do believe, with like early childhood education and ADHD.
Right on.
Uh,
Um,
yeah,
uh,
but before I totally out myself as not knowing who the fuck this is, then let's just see who this is.
Dr. Barkley is a retired researcher. He's got credentials that I'm sure I could look up, but I don't know. Is he a psychiatrist? Is he a psychologist? I don't know. He's got degrees and shit, and he's published a lot of studies, and he has published a lot of content talking about ADHD. I have heard him referred to in various circles as the godfather of ADHD. He's been involved in the research and education aspects of ADHD for a very, very long time. Like I said, he's retired. And since retiring, he has founded a YouTube channel, which is really, really cool. He does weekly deep dives into specific ADHD adjacent topics. Um, like body doubling as a ADHD strategy or comorbidities with ADHD. All of it from a pretty research adjacent and science oriented frame of mind. And one of my favorite things that he does is a weekly roundup of research. Like he looks at the papers that have been published or pre-published in a given week, and he's like, "Here's a synopsis of this. Here's why this study is very interesting. Here's why this study is something to be concerned about from a methodology standpoint. It's the kind of thing that really excites Matthew Brain. However, some months ago, let's see, does it tell me? So this is published on his channel 5 months ago. He published a video called "Owning Your ADHD," and as we kick off, I'm sure he will explain why this was a topic that he was interested in diving into. But it was one of the first times where I was like, "Dr. Barkley, I don't know that I fully agree with you." It was
Mm.
definitely a little bit of a. Some of it made sense to me, and some of it was not perfectly aligned with the way that I was thinking. So I wanted to share it with you,
Yeah,
and I wanted to watch a little bit of it, and then chat with you about it in segments. I don't know that we'll get through the whole thing. It is 15 minutes long, and my suspicion is that we'll watch a minute, and then you and I will talk for an hour. But let's see what we come up with. What do you think?
I'd say let's go for it.
All right, man. Here comes Dr. Barkley. Got the sound
Da-da-da.
here. All right. I assume you can see this all right.
Yep.
All right. Hey, Dr. Barkley, what you got for us?
And a good day to you, friends. Russ Barkley here with more information on ADHD. Today's topic, I suspect, might be a touch controversial. We'll see. But as a clinician, I have to tell you that this is one of, if not the most important issues that have to be addressed when dealing with ADHD, particularly in teens and into adulthood. Not so much for children. We don't expect them to carry this level of self-awareness and acknowledgement, but certainly by adulthood, we do. And that is the issue of owning your ADHD. Now, Adam Levine made a video about this very topic over a decade ago. I think it was on behalf of Shire Pharmaceuticals, but nonetheless, the topic remains relevant today. And that
You put on
is the
subtitles?
idea that
Can I put on subtitles, did you say?
Yeah,
Yeah.
thank you.
I these are the automatically generated ones, so they should be approximate.
Yeah, that's fine. It's something I've noticed that I need. So
Yeah. I basically don't watch movies without subtitles these days.
we found a theater cinema here that does subtitles.
No shit. That's
Changed
crazy.
our lives.
Right on.
Mhm.
Proceeding.
Yep.
that one needs to own their ADHD before they are going to make changes to themselves, make changes to accommodate their ADHD, seek treatment, and in general become more effective at living, at coping with their ADHD than they would be in other cases. I have to tell you that my own fraternal twin brother, Ron, before his passing, was incredibly good at not doing this. So I want to talk about what he was doing and what you should be doing instead. So let's have a look here. First off, you need
So before he goes into the full deal here, um, I'm curious at first blush, what is your reaction to being invited to think about the concept of owning your ADHD? Like, what are the first things that occur to you?
I guess it depends on where he goes with this. I often find that it's helpful to strategize. I think having ADHD and not knowing the importance of like really practicing the art of presence and putting things in orders and lists and so forth in order to stay on top of what you know to be a deficit, like saying, "Oh, I'm not going to forget that," when you know you damn sure you're going to, like not being accountable to your own deficits and knowing what they are. I think is important, just self-awareness, right? But I do find the ironic twist of needing to not have ADHD to manage your ADHD.
For sure.
So I'm interested to see where he goes with this.
That invites the conversation about, is the point of medication to make a disability less challenging, or is the point of medication to make a neurodivergence less divergent, to normalize somebody? There is an interplay, obviously, between how normal we are and how much friction we experience in our lives. But like, there are definitely arguments that people with ADHD didn't struggle to thrive in different societies through time, hunter-gatherer, yada yada.
Yeah, and I think that's purely academic because once you one with a diagnosed it's interesting. I was talking to my cousin about this the other day because like just on a blink, just spending time with her, I'm like, you are so fucking ADHD.
Yeah.
But she's never been diagnosed. And she actually said to me, she's like, I think I might have ADHD. I was like, you think? Um, and she's like, but I'm so afraid of, being put on a razor's edge with stimulants that can be abused, blah, 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 because she also is recovering. Um,
Yeah, I've got another friend who uses the same concern.
And I said to her, I said, okay, but the diagnosis doesn't immediately single track you into amphetamines. Like it's not one must then therefore be the other. Like just because you have a diagnosis doesn't mean you have to treat it with ADHD medication. They're not
Yeah,
mutually exclusive. And so the simple act of knowing gives you context, language, and a community. For me, simply knowing what was going on was more important than the regulation through medication. My choices of medication through a variety of different types that I've tried is finding a way to counterbalance some of the more negative effects.
right.
I would rather be on ADHD medication and not deal with the never ending crippling depression and anxiety of forgetting. Maybe as I go through life and unpack the CPTSD that I've experienced surrounding the stim, like what you're talking about, the social aspects of it, like how much has been beaten into me that, idiot, fool, slow, all that stuff, right? That's second to me being in the present and going, yeah, but my brain be workling, and that's more important to me. So I guess it comes to more the individualized approach, like diagnosis doesn't equal now you must, be stuffed full of meds so that everyone else can put up with you. It's got nothing to do with everyone else.
There's an interesting for Matthew. There's an interesting um, uh, human behavior that I see when you characterize your cousin's concern around. I'm nervous about um, pursuing a given piece of knowledge because I believe at this point that that given piece of knowledge implies a set of actions, maybe even a set of responsibilities for actions.
Yeah.
Um, that is an abstraction that I struggle to make, to separate the idea that learning something, that developing awareness of something doesn't imply a causal, narrowing of options.
Yeah.
If I acknowledge that I'm angry about something, then do I have to admit that my argument is wrong? Like it does me force me to
Yeah.
do that sort of thing. And in the
Yeah.
context of the video that we're watching, one of the things that, if I recall correctly, he may dig into it a little bit more. One of the things that I recall is the notion that if you are capable of changing something, does that imply that you are responsible for changing something? That is your obligation to change something. If I discover that I have ADHD, is it my responsibility to manage it, or in his parlance, own it? If I discover that I have health-related problems that are associated with um, uh, uh, being overweight, is it my responsibility to do something about that, or is it like a life choice? Those sorts of things. That abstraction, both in the context of are those two separate things, and are you able to sit with and operate with them as though they're two separate things, and does A imply a ethical, moral, social, interpersonal responsibility to pursue a given route afterwards? That's something that I wrestle with a lot.
Yeah, I mean, there's a lot to unpack there. I think that I would start with this just simply saying that two things can be true simultaneously. In
That's
that,
tricky to implement, but it is something that is on
I
my
mean,
mind a lot these
it
days.
is, if it is nothing that has become like a sort of a core check back for me. It's something that I do constantly check in with. It's like, can two things be taking up space simultaneously? Because it's not always necessarily a versus mentality. It's not always a zero sum game.
Totally.
So I guess it's one of those where going back to the individualized sort of application of it, like does changing, and again, using the three steps of the serenity prayer, right? It's like at first acceptance, right? So you take in information, whatever that may be. Do you accept this to be remotely applicable to you? And if not, can you simply accept the fact that it exists
Right.
extant to your own application? Like, can you just be like, that's a thing and let it exist in that space? Second is, does it need to change anything? Do you personally feel called out, called in, or like, however, does it resonate with you in a way that makes you think, huh, I would like, do you envision a world where addressing that would be to your own betterment, regardless of anyone around you? And if so, do you want to? Do you find willfulness within the context of changing said? And therefore, do you go forward? And, the third part being, do you know the difference? Do you know the difference between going,
Mm.
yeah, that's a thing, but I don't need to do anything with it, about it, or for it, and it's not going to change, it's not going to make me personally any better or different, so I don't need to fool with that. So, in this context with ADHD, it's like when you become aware, um, first of all, I don't know that anybody becoming aware of an entire subset of language and ways of understanding yourself could be bad. Like, it's not of detriment to yourself to become self-aware.
Have you ever
Like,
heard of Rocco's basilisk?
no.
I won't divert us too far, but the basic idea is there's a set of thoughts where the act of having them dooms you. Like if you consider something as possible, suddenly it becomes possible and inevitable, and it's awful. Um, this is all in a very sci-fi fantasy kind of
Yeah.
artificial intelligence context.
Mm,
But you know, the
yeah.
part of my brain that is consistently like, can I think of a counterexample? Rocco's basilisk is something that I can think of in the context of, is there anything about which I were to think that it would be just thinking about it, just bringing it into my awareness would be a terrible idea? And now, of course, I've shared it with you, so you're also doomed to be
No,
tortured
I'll
by
have to.
advanced AI.
Yeah. No, it's an interesting thought, right? But I guess, like, I don't know. I'm interested to see where he goes with this, because, like, I do encounter lots of ADHD quote hacks, helps, and
Sure,
life lessons and so forth. And I just sit here going, like, have you ever actually met someone? It's like you wonder if they're speaking intellectually about something they have no interface with.
right.
It's, does this just sound good in your head? Like, have you ever, like, are you serious? But it comes back to the kind of, like I said, I think, at least for me personally, it's a challenge to take in information, because I have always then thought, oh no, new information, I must adopt it into my mainframe. It must
Right.
be a thing that I have to interact with. Um,
I feel like I've received a lot of critique in my life for not knowing something that ought to be considered obvious, or
oh
for
my,
knowing something that ought to be considered obvious and not taking advantage of that knowledge, still falling for a given trap. A
mm,
lot of the ADHD adjacent critique, that usually devolves into being accused of being lazy, seems to be in some way associated with the you should have known better.
mm,
The inverse of that, of you have so much potential, seems to be in some ways a similar comment. And that's probably the biggest first reaction that I have in hearing him describe the topic, and then sort of girding myself for whatever he's about to say, is like I've felt threatened a lot of my life by people's perception of what it is that I should do in general, and should do in the specific context of ADHD,
mm,
and like navigating that, like choosing the portions that are optimal for getting along with others, that are optimal in the context of, like, manifesting the most actualized Matthew, has been a lot of my life's work.
mm.
Um, but anyway, should we listen to
Let's
more?
get back into it. But these are lots of juicy points and topics and so forth. But I want to see where he goes with this before I make too many assumptions about it.
All right, Dr. Barkley, take it
I
away.
can't get over the spell am
All right.
I supposed to own, not an. Typo is
Oh
killing
yeah,
me.
yeah, yeah. Total typo.
I'm like,
Um,
how did you not see that, dude? That's
well,
driving
it's
me.
not like he's got advanced degrees or something. That is really funny. Maybe he
That's
should
just
own
spelling,
his
man. You
spell
don't need
check.
to spell.
All right,
And
let's
a good instead.
here
So
we go.
let's have a look here. First off, you need to accept that you have these symptoms of impulsivity, of inattention, of the hyperactivity that may be going along with it, but especially of the executive function deficits we've talked about here many times, the problems with time management, with emotional self regulation, with self organization, self motivation. All of this is part of ADHD. So, and then along with that, maybe other limited capacities that come with comorbidities, like learning disabilities, for instance. So, what we're saying here is to take stock of yourself and the degree to which you are experiencing these difficulties, and then own them. The kind of part of who you are,
Subtitles
what
back
you
on.
are, the way you approach life in general, and denying their existence or
Subtitles back
minimizing
on.
their existence.
What's that?
Put the subtitles back on.
Oh my God. Fail.
It's all good.
Just because you're trying to protect your own ego, it's not going to get you anywhere. Things aren't going to improve through denial. Right? So, owning your ADHD is simply admitting this is me. This is my nature. These are my characteristics and my features. And then going about trying to adapt, adjust, accommodate, and treat them. But none of that is possible without ownership. And that was Adam's key point. Just as he was treated for ADHD, particularly with medication, growing up, and then gave up the medication and denied his ADHD as a young adult, and then found himself coming back to ownership of his ADHD in order to help further promote his own success at life, at music, as a television star, as a celebrity, as a brand owner.
I wasn't sure that he was fucking talking about the Maroon 5 Adam Levine. I was like, oh, Dr. Levine, the other ADHD researcher. No, he's talking about the goddamn rock star.
Uh,
None of that would have been possible without him owning it and getting periodic treatment for it. That's being realistic rather than being delusional. Now, along
All right, so like this is definitely we've definitely tipped, full bore into things where I have complaints. Um like the definition that he is using around ownership is ambiguous to me to begin with. Like said, at some points he seems to be mostly treating it in the context of like, do you acknowledge that these things are true?
right.
And then in other contexts he seems to be using it in the context of like, having acknowledged that these things are true, you are responsible therefore to do things to mitigate it, and that's something that he gets into a little bit more later on. But I find that really challenging, both in the context of um, diagnostic certainty, and in the
Mhm.
context of the profound ambiguity associated with um, whether a given behavior, experience, or circumstance is accurately looked at in the context of ADHD. Like Dr. Barkley speaks at length in other contexts about the difficulties associated with diagnosing ADHD. There isn't a blood test. There is no straight up, you definitely have it, you don't. We can't do a brain scan. We can't autopsy somebody with ADHD and be like, oh, they definitely had ADHD. Like the diagnostic criteria are self interview, friends and associates and family interview, or a computerized testing rubric where they're monkeying with your ability to respond rapidly and in the context of working memory. And all of
Mhm.
those tests provide some useful perspectives and insight. but they suffer from no small amount of subjectivity, both in the context of the answers that the interviewee provides, and in the context of interpretation, where the practitioner is applying, the nine inattentive and the nine hyperactive traits. Dr. Barkley often critiques the number that a given adult ADHD sufferer must have of traits from either column in receiving the diagnosis. So, if it is so challenging for the establishment, the scientific establishment, to be certain that an individual has ADHD, it seems counterintuitive for me to say that an individual should be certain about their own diagnosis. Then you throw in things like comorbidities, the environment in which they receive the diagnosis. If the family doesn't accept it, but the doctor has said it to the child, what is the child's responsibility as it relates to that? So it seems
Mhm.
it seems like there's a little bit of a cart before the horse thing going on for me when I hear him,
Yeah.
you know, saying that there are responsibilities, particularly both in the context of believing that the diagnosis is true and the subsequent description of traits, but also in the context of what that implies about your choices.
Yeah. And I think that it is, I mean, I agree with at least his first point in, like I would even just said it, like it's about there is a level of acceptance to whatever about, like, if you look at it more like a spectrum, you look at it more like it is just what, like you're saying, it's so nuanced. There's so many different traits that, I mean, somebody could have most of them, but not all of them, have other things that come into play and so on and so forth. It's like, okay, that doesn't change your ability to identify something that is routinely a problem for you. Like, you could
Mm,
have a list a mile long. Two people with the same diagnosis could have different things they struggle with. Does that mean that one of them needs to add the things to their list that the other person, it doesn't, it's academic. It's like, if you feel like, even if I had never been diagnosed, I would still resonate with it to the point of going, okay, why do I resonate with this? Well, because I struggle with it. So, is there a level of acceptance that that is simply the case? I think one of my biggest struggles was, now that I know this to be the case, I am now in a state of grievance. No, that's not the right word.
grieving.
Grieving.
Yeah.
Yeah, because shit, that's me. But the societal impetus being like, you are broken, right? Like, there's something wrong with you. It now has to be treated. Um, and that's not a very self-compassionate way of looking at it,
Right.
because that is implying that you do have a deficit. I think the biggest and hardest thing about ADHD is the D. It's not a deficiency, it's just a
Two
different,
Ds.
class D. Whichever the one, the deficit one.
Yeah.
I don't even know how to spell it. But yeah, fuck acronyms. No, yeah, but the deficiency or the deficit part, it's like there is always going to be a pejorative connotation to anything non-normative. But that
Oh,
doesn't mean,
feel that in
yeah,
my heart.
yeah, and I don't think that that's compassionate or fair at all ever, because being differently minded or wired isn't hierarchical. There's no optimal human. So when we decolonize the constructs around normativity, all of a sudden it's just a spectrum of behaviors and so forth. And then what you're more looking at is which ones negatively affect my ability to just simply get on with it.
Yeah.
Even if we didn't live in a capitalist society, I would still be forgetful to the point of um, it being problematic to the people that I love in my life, because there is a part of it where the responsibility, from my viewpoint, is, are you hurting other people by giving them the impression that you don't give a shit?
Right.
And would an acceptance of the fact that you forget things sometimes, never, rarely consciously, right? So I unconsciously or subconsciously, whatever, don't always track with things. I don't always put the dots together. This could give an impression to somebody that there's a level of care that I can or don't provide. Then they question the willingness to do so and so
Right.
forth. Well, if I never know this and never say a word about it, like, that's going to continue to be a problem. Now, I can call it, purple lizard disease. But if I'm able to identify within myself a certain thing and there can develop a level of communication around that, I think that the one other part of this, and I'm interested to see if he gets into it, is the ableist aspect of it.
Hmm.
And that is like, so I have these limitations. I don't need to go crawl into a corner and come up with lists and feel sorry for myself and then turn around and produce something for the sake of other people that lets them have an easier time of dealing with me. That seems counterproductive. It's like I can communicate what I know to be myselfness and say, hey, look, I have an issue when it comes to X, Y, and Z. Is there a way we can accommodate this such that you're always presently aware of where I'm actually coming from? I'm doing my best on my end, but I'm not perfect at it. And it's not my responsibility to carry your comfortability around it.
Right.
So, can you meet me in the middle? Can you meet me where I'm at? Can you stand with me in the present moment? So, there is a give and take, and it is extremely reductive and ableist to expect the person with the quote non normative or the quote deficiency to do all the heavy lifting.
Is
And
it
I,
is it correct then to say that one of the one of the things that you're experiencing hearing his preamble here is that the aspects of the value of looking at your life in a self introspective kind of way are profound, irrespective of a diagnostic framework. Like you're like it makes sense that an individual ought to examine what is succeeding and not succeeding in their environment. And that's true regardless of whether it's an ADHD scenario or not. However, and the big pivot for you is you struggle with the idea that society or people external to you should be able to dictate to you what it is that you would do having made those observations.
exactly.
Right
Yeah,
on.
I think that's a good summation. Yeah. It is not a sole responsibility to make everyone else comfortable.
That's interesting. Yeah, he gets into some of that stuff later on, if I recall, specifically the ways that an ADHD individual can be disruptive, particularly in group or like classroom environments. Well, let's see if my memory is correct.
Yeah, I mean, let's see where he goes with this.
This time I'll try to remember to make sure the
Subtitles, please.
subtitles stay on. Let's see. So share and then full screen, and it looks like they're on, and here we go.
Along with that, own the larger suite of physical and psychological traits that you have. I'm 74 years old. I'm aging. I'm getting weaker. I have color blindness. I am bald. I am terrible at visual spatial relationships. That's why the Air Force wasn't going to let me near a plane and made me a radio operator when I was in the military. I'm not going to be good at doing those things. And on top of that, I've developed a slight left facial weakness as I've aged here. And I have many other personal faults and foibles. Boy, you don't want to see my golf swing or my golf game. I kind of look like a tasered monkey, as a friend of mine acknowledges. So, part of that is simply owning who you are, right? That's me. I'm not somebody else. I'm not a great golfer. I'm not good at art or visual spatial stuff. I'm not very coordinated either, right? So I stay away from that stuff if I can, and I own the positive as well as owning the negative. And in so doing, I have made a realistic appraisal of myself. And that's what Adam was encouraging people to do. And that's what my twin brother could not seem to do, was to own his difficulties. Instead, he went around blaming circumstances, other people, and so on. We'll talk about that in just a moment. Now,
So yeah, that section, like, it seems to like walk along that line that you were outlining, related to the introspection and
Mhm.
the implied responsibility. Like he uses his age-related stuff as an example, which I think is really interesting because there's a vulnerability associated in pointing out your own shortcomings, even if they're ones that are maybe not thought of in the same pejorative context as ADHD. But it's absolutely true that a lot of people, as they age, have diminished faculties in various ways. I'm not Dr. Barkley's age, but like I'm going to be 50 pretty soon, and that comes with some. I'm not able to do the things that I used to be able to do. But there's a
Sure.
distinction, apropos your earlier points, between my acknowledgement of what I am and am not able to do, my choice to be more careful as I lift heavy objects, my choice to be aware that taking a spill that would have been no big problem, skin knees, when I was smaller, might, be life changing now if I, break a hip or a knee or what have you. Those are things that are meaningful to my internal construct of what is and is not wise for me. But we think very differently about that at a societal level. Like we don't currently take away people's driver's licenses, even though we have really good statistical data about when, on average, people probably ought not be driving anymore, whether it's from an insurance perspective or from a public safety perspective. There is a lot of concern about ageism in employment, even though we know that people do stop being able to do certain jobs as well. So like moving that pivot from this is important stuff for you to consider about yourself to, as a society, we ought to be setting policies that do and do not permit things, even if that policy is only at the shaking your finger and saying we have responsibilities that you're not meeting level. We're more cautious about that, and it doesn't feel like he is acknowledging that division.
I don't think that that is where he's at with this.
Oh,
I
yeah, what
get
do
what
you
you're
get?
saying. I mean, I hear what you're saying. Um, but it feels like he's at this point staying on track with the idea of self-awareness in the scope of your own abilities and limitations, regardless of what societies should do with that. I don't think that he's necessarily implying, the external world yet. Anyway,
Oh, interesting.
the
Sometimes I think that a speaker of like somebody who is working to do science education or health education has kind of a responsibility, ha ha ha, to acknowledge and consider all possible outcomes and interpretations, to the extent that the human mind is able to be that thorough.
right.
But you're sort of taking this from attack of like he may or may not have a set of implications in his mind about societal obligation and or responsibility, but at present you think that he's pretty exclusively speaking about introspection and self-awareness.
Yeah, I mean, he might have viewpoints on that, and I don't think that he's addressed that yet, nor do I feel like he's necessarily shut the door on that whole um aspect. Like he's not like, yeah, that's, and we do all this to make everyone else happy. Like I don't know that he's explicitly made that point or avoided that point.
I gotcha.
Um, so I think it's kind of maybe further down the line sort of thing. But at this point, I think that he's speaking mostly just to the concept of self-awareness and how that applies to others. Like I think about when he's talking about his brother, the one thing he said about, and he said he's going to get into it later, so I'm interested to see how he unpacks that. But he was talking about like blaming and the externalization of your own stuff, like basically not staying on your own side of the street. Because
Right.
when there is a refusal or a lack of acceptance, you will project that onto circumstance and people around you. I mean, there's a lot of strong consideration to what you project. And a lot of that comes from assumptions of self or corruptions of ego, however you want to look at it, from a Jungian perspective, like how much of your shadow self is projected onto other people. Um, and circumstances when really it's something that you yourself could learn to simply accept and understand. And then that just sort of reduces how much other people get put upon, because it's like there's the one thing to be aware of something that you do and it bothers somebody that you care about, like people that are just writ large. So what? You don't like it, whatever, you know
Hmm.
uh, but if it's genuinely bothering someone else, and I'm sure you've come up with or come across a few things maybe in your relationship with your partner, once or twice where you do something that annoys them or that bothers them, and it is worthwhile to become aware of that, check what you're able to do, what you're willing to do, what you're capable of, and coming to the space with, this is where I'm at with this is what I can try to do to you know um, be attentive to your concerns. However,
Right.
maybe there's a little bit of give and take here, because maybe in recognizing this, there's also something that you might be like unconsciously expecting or projecting. And we don't need to be in a constant state of bumper cars over this. We don't need to be trying to pad each other's experience. It's, like I said, it's not a zero sum game. I think that it was Heidi Priebe had a video about confrontation within the discussion of needs, and like the becoming comfortable with the idea of disappointing other people.
Yep.
Uh, and from an insecure standpoint, relationships can be viewed as a zero sum game. If I give this bit, I'm never getting it back. If I do this, I am depleting something,
Yeah.
like, and it's more a case of, no, we can both work with this. Um, I had a point. I think I drifted off of it, but
I think the thing that I'm most activated by in this circumstance, as far as like an intellectual defensiveness, um, is that like self-evaluation and understanding our role and relationship with others is a never-ending assessment. Like
yeah,
it, you don't ever have a point in your life where you're like, it is clear what my capacities and deficits are. It is clear what my responsibilities are. Like that is an ongoing exploration. At the most minimal level, the the experience that is basically universal for ADHD people is regularly being asked to behave normally pre-diagnosis,
Right.
not being able to do so, and people being sufficiently confused by that that you are either taken to be diagnosed or you are encouraged to go, inquire about a diagnosis. After which, the structure of self-perception and obligation changes. Like we don't say to the unmedicated, undiagnosed ADHD child that we think might have ADHD, you know, why can't you act like Johnny? Or we don't if we're,
Right.
responsible. We say, oh, we need to get you assistance. And it's only after we've gotten them assistance that we then, try and contextualize these things in the framework of responsibility or obligation. And
Right.
like the acknowledgement of that fluidity is kind of what I'm missing here. Like he
Yeah. Yeah.
wants you to fully acknowledge your ADHD symptoms when an ADHD diagnosis is not a finite or a concrete thing. At population levels, we have no ambiguity about the existence of ADHD. At the individual level, there is quite a bit of subjectivity, in the context of when and how you're diagnosed, what the interviews were like, what your practitioners were trained to do, what their biases were, what your biases are. And
Right.
then whatever your diagnostic outcome is, that evolves through life. It was in my adolescence to adulthood that the framework of ADHD dissipating in adulthood was abandoned. It used to be
Right.
believed that I wouldn't have it as an
Go
adult.
out. Yeah.
Clearly not frickin' true. So
No,
this
worse.
this set of constructs around here are the things that you have an obligation to own. And again, he's continuing to be a little bit ambiguous between, when you say own, do you mean acknowledge the truth of, or do you mean behave in a given way as a result? But like his insistence on owning, he's maybe not insisting. Maybe I'm feeling a little pressed, and it just feels like he's insisting.
You're
But
feeling
like his insistence feels to me like it is in the context of failing to acknowledge that there are ambiguities that can make it very difficult for an individual to be certain in the way that he is describing certainty or execute upon that certainty. And that's true at the individual's level. It's true for their family. It's true for their workplace, etc. And I'm hoping for some of that. He is very cautious to use that sort of understanding when, for example, analyzing the quality of studies. One of his one of his favorite critiques is the misapplication of correlation as being causation, and that is not him saying the conclusion of this study is wrong. It's him saying the evidence that they've used may or may not support it. We don't yet know the answer. So I feel like that sort of ambiguity is something that he's comfortable exploring in other contexts, and I'm, you know, mildly frustrated not to see it in this context.
sure. I mean, I think at this point, like, I don't, it's like I don't disagree with where he's at. Um, but I suppose choosing to see this from a more like a narrower viewpoint in that what is the like I guess more like what exactly is it that he's addressing more specifically within this video and
Man,
within
maybe we
content?
should let him talk more.
No, no, we're gonna make all sorts of suppositions and assumptions about what's not even said yet,
Yeah.
and there we're gonna backpedal off of what he hasn't said yet.
All right, Doctor, you can have your say.
Go on.
At least until 6:50, where you have put in another break.
Speak, prophets, and we shall judge you
maybe
accordingly.
maybe in the interest of yeah, maybe I'll let him go 2 segments this time, and I'll try to remember to take notes.
The next thing you have to own are your actions and their consequences. As Stephen Covey said in his great book, The 7 Habits of Highly Effective People, when you pick up one end of the stick, you pick up the other. When you engage in certain actions, those actions will lead to certain consequences, often foreseeable. You've got to own both of them. You can't just say, well, I did that, and then deny the outcome. You have to own the action and its outcome. I am responsible for what I do. So are you. And there is no way you're going to improve your circumstances, much less get treatment for your ADHD, if you don't own these actions and what they're leading to in your life. If you're speeding with a motor vehicle a lot, if you're double parking, if you're driving up on sidewalks because you can't wait in line for a traffic light, right? There are consequences for doing that. There are multiple citations. There is a loss of your driver's license. You may, in fact, injure other people because of your poor delay of gratification. You got to own both of those, not just the one or the other. Now, in addition, it means appraising the larger status of your life. Where am I? How much education have I got? Where am I living? What is my financial situation? How am I doing? These are all global, reliable measures of how we are adapting and succeeding in life. How are you doing? Can you realistically appraise that? Are you independent? Are you self-supporting? Or are you living at home in the basement of your parents' house, working occasional part-time unskilled jobs, playing lots of video games, and then blaming life for the fact that you're not doing as well as other people you may have gone to school with? So you need to realistically assess your situation. And my brother often denied those facts on the ground as we find them. How can you get better if you won't accept and appraise where you are, and then you can start to improve that if you wish to do so? You have to own your decisions as well about whether or not you are getting or not getting treated for your ADHD. That's nobody else's problem, right? It is not incumbent on other people to get you treated. First of all, if you don't want it, you'll refuse it, so they're not going to do any good. Reminds me of the old joke that psychologists tell. How many psychologists does it take to change a light bulb? Just one, but the light bulb has to want to change. Man, if you don't want to change, nobody else around you, none of your loved ones, and especially your friends, are going to be able to do that for you. Even though they might try because they feel sympathetic to your plight and want to help, what it finally comes down to is you and your decision whether or not to own your ADHD and get appropriate evidence-based treatments for it. Now,
Oh man.
All right, now I got thoughts.
Yeah, man. I took
Yeah,
some notes. I hope the typing
that
wasn't too loud.
that started to get a little condescending and reductive
What were the
because
things that felt condescending and reductive to you?
I mean the first thing I jotted down here was drifting metaphors. We're
Hmm.
either talking about how you are a subject of the context of greater social well-being, or you're talking about the individual need for
There
self-identification.
is a lot of back and forth
Do
between those
not
two.
jump around between the two, because then you do end up back in the problem you were talking about, where you're trying to bite off two heads at the same time. And one, it's not all this, like, I must address my ADHD because it will simultaneously help me and make everyone else less, like, I'm sorry, but at no point is undiagnosed ADHD going to cause you to drive on the side. I mean, it just, like, I don't know. Like, I get it's a
No,
method.
there's some serious traffic related outcomes associated with ADHD that have been established at a
Fine, but
population level.
I'm sure there are equal studies that would put sensory processing disorder into, like, why people do things like anger management issues. Could ADHD be it's not, it's like we're trying to use ADHD as the only marker here. Like, I get
Hmm.
that that's his topic. I get that that's
In
where
his
he,
career,
but what he's not identifying is the wider kaleidoscope of comorbidities, of other things that can be factors. Uh,
That stood out for me in the context of treatment. Like I'm not certain that the driving on the sidewalk or traffic stuff, in the wider kaleidoscope resonates for me in the same way. But I think that the example of, you have an obligation to get treatment, you know, that really needs to be discussed in the context of access.
yeah,
Like the amount of difficulty that I have had finding providers, like whether it's, people that are listed on my insurance site that have stopped taking my insurance,
yeah,
providers that are not accepting new patients, having to pay
yeah,
outside of the context of insurance, medication shortages. Like, how much are you holding me responsible in a circumstance where
exactly. And
so
I
much of the system is stacked against my ability to do it? Never mind that all of the tasks associated with navigating it are fundamentally very difficult for ADHD people.
absolutely, yeah, and which is why it started to really bother me because we're going back into you have to be backslash have a professional involved in the first
Right.
place. Like I diagnosed my ADHD through Instagram, but
Yep.
long before
A
I
lot of
went
people
and
do.
got the professional like stamp of approval. I
Right.
wouldn't have not had ADHD if I never went to a doctor. So it's
For
not
sure.
like the professional who has the like it's just clinicians and therapists and people like often act from a place of without them people wouldn't know these things exist, which is kind of like saying that gravity didn't exist before Newton. It's like, no, dude, you just put a word on something that was already happening. You just put fancy white people language around something that already existed. You don't all of a sudden have copyright protection to it. Like you are not the gatekeepers.
You're not accusing him of not believing that you have ADHD until you have diagnosed.
I think that there is a subtle implication here that the diagnosis is the gateway to the understanding, like that
Oh, interesting.
you cannot be aware of these things without a professional clinician stepping in to save you. And then after they've said all of their, degree based words, you must now go and fix everything about your life. So I think that he's oversimplifying and being reductive because there's just a lot more factors to it. Like I was hoping that it wouldn't have drifted into the you simply need. It's just the irony of telling somebody with ADHD, you simply need to get better.
Right.
Think about it. It's going back to the why don't you just change this? Why don't you do things differently? Why can't you just remember stuff?
Anything that has just in it.
Yeah, and the constant use of the word need. Like, no, I don't need to. Could it be of a greater benefit to my standing, my life, and other people? Sure. Do I need to? No. That is a choice that he seems to be implying is necessary.
There
Like,
is a normative aspect to it. Like he definitely
yeah,
describes these things in the context of what feels like an unambiguous endorsement of the current society being correct. Like his entire rubric around success, for example, like
yeah,
the way that an artist measures success versus the way that an academic that measures success versus the way that a financier measures success are going to be very different. And he might argue, and it seemed like his language was arguing, that all three of those need to define their success in the context of the current world. But, like, you know, practical outcomes notwithstanding, um, there are a lot of harms around the current status quo, whether we're talking about politics or capitalism or the political regime, and to accept and endorse the ways that current success is measured, like am I able to pay my taxes, is not a clinical or a medical perspective, you know, and
Exactly.
that's an odd juxtaposition. And then
Yeah,
like at a more philosophical level, there's also just like the whole relationship he's articulating between obligations and foreseeability. You know, the arrival of predictable consequences. Like fundamentally, we're talking about a set of people who prediction is a fucking struggle for them. You know, like
yeah,
being able to associate an outcome with my behaviors is one of the things that I struggle with. And
right.
contextually speaking, they may not have ever arrived. You know, if your family noticed early on that you had a problem and is a well founded family unit, you might have had all sorts of guardrails that were preventing you from seeing some significant outcomes of your ADHD that then when you go out in the world and don't have those guardrails were invisible to you until now. Are you suddenly responsible for those? You know,
Right.
versus somebody who like hit every freaking branch falling out of the tree, you know, and being able to grab the reins of that sort of self-understanding and self-management much earlier in the process, mitigation or not.
Yeah,
It's odd to me to hold somebody accountable for those things when there are, again, so many ambiguities and contextual differences in different experiences.
for sure. Yeah, so I was saying it's like I would find it, I would be hard pressed to believe that ADHD, its diagnosis and, DSM listed struggles or identifying factors or whatever are the picture. That's it, right? He's trying to squeeze it, the entire scope of life and what you must like, what one can benefit from as far as self-awareness goes, having everything to do with ADHD.
Do you think it's
Like,
the when you're a hammer, everything looks like a nail problem, or do you think there's
yeah.
something else going on?
Well, no, I think that it is, it's a mild level of chauvinism almost
Hmm.
towards this is like a solution. Like being diagnosed with ADHD and getting treated for it was 1/10, well, what's starting to become more like 1/100th of the things that I struggle with that
Yeah,
I've had to become aware of through my own need, again, my own desire to, not my need to, in order to be productive in society.
right, right.
It's my desire for self betterment, but has nothing to do with ADHD. Could it have compounded? Absolutely. But now that, between my therapist and I mean, I'll probably be taking the test soon, but he's like, yeah, you're also type 1 autist. I'm like, yeah, you don't say. So gold standard ADHD, absolutely. So then there's that to come into play. And then all I could think about while he was talking, though, was like, so you mean to tell me that somebody who uses video game playing because it's self-soothing and because it gives them the ability to regulate themselves within a context they understand, and they live at home because maybe they have a high level of executive function disorder that is preventative when it comes to their ability to quote function in society. Like they need the support of their parents because they have chosen that that is the better route. Now,
Yeah, totally.
what he's skipping over is the sheer amount of communication that has to exist between the individual and those around them. So you mean to say that without any other evidence, and I speak from personal experience because Phoenix, our son, eldest son, he has extremely high executive function disorder. He's a high needs kid. He doesn't have the ability to simply list out what all that does is make him even more depressed because he starts to feel like the grief of not being able to be a quote normal person. So instead of consistently pointing out the inconsistencies, and the problem, the points of the pain points, it's more a case of where can we meet you? Like, and it
Sure.
just may be the case that his need to engage with, video game play, is there some of that that could be avoidance and dissociation? Sure, but that is also something that he uses to self-soothe, and that's how he makes connections. That's
This
how he interacts with his world.
this raises a really interesting point. There are, I think that I have to assume that Dr. Barkley would endorse the idea or acknowledge at least the idea that there are conditions that an individual can have wherein responsibility no longer applies, whether it's in a clinical or a legal or
Right.
societal framework. Like if somebody is undiagnosed, unmedicated schizophrenic, society definitely has to deal with, the family definitely has to deal with the outcomes, but we're
Mhm.
not generally looking at the individual and saying, you are doing things maliciously bad. We're
Right.
saying you're suffering from a disorder that's preventing you from behaving in a way that you
Right.
otherwise would. Or since often ADHD is considered in the context of cognitive or learning difficulties, we don't hold people with Down syndrome responsible for societal contribution or legal contribution in the same way. Again, we
Uh,
do things as a society to prevent them from causing societal harm, but we're not, putting them in prison for those behaviors. We're putting rails around
yeah,
their
I
experience.
think,
So
yeah,
where then is the transition? Like at which point, in this spectrum of responsibility, non-responsibility, have we determined that ADHD falls squarely in this context of no, 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 you're responsible for that behavior? The ADHD is a spectrum. Every single one of the symptoms is something that normal
right,
um, uh, um, neurotypical people have. It's when they're described in the context of disability, they're seriously interfering with life, that we move it into the context of being a disorder. So we know that all of this experience is along a continuum of capacity and incapacity. Why are these traits ones for which the individual has responsibility? I'm not arguing that they shouldn't. I'm
right.
asking, like, since we acknowledge, as a, academics and intellectuals, that there are some things that fall on either side of the line. Why? Well, first of all, where do we think the line is, and why do ADHD things fall on this other side of the line? I think that that's a big portion of the reasoning associated with, and therefore you must do X, Y, Z. The implication of ownership needs to stem from a sense of like, what is defining the requirement for that ownership, and like a sense of like, my ADHD child is inconveniencing other people at school is not adequate to me. It needs to be more
Right.
than that. That's definitely a problem. I'm not pretending that that doesn't exist, but we need
Sure, sure.
something else that helps us, like, sort things into this they
Exactly.
need to take responsibility for, and this I need to take responsibility for helping
Yeah.
them with.
I mean, and it does. I think that there, and this, I just sort of put a few things together as you were talking. Um, I think that there is also this sort of like trend, and this is, I mean, I'm not going to say this with like absolute certainty, but it is definitely a very American thing. It's a capitalist mentality to return all responsibility to the individual, meaning that individualist, isolationist is kind of the goal, right? Keep you separated from the pack. I think that there is, okay, but what are we implying about the idea of social network support by saying that the individual must own all the things and be responsible for all the things? are we not leaving out the wider arc of the social network? If it is down to us and us alone, and we are, quote, inconveniencing or putting off everyone else around us, what are we saying about the idea of commonality and being able to use even just a clinician as part of a support network instead of part of some sort of corrective treatment? Like, being able to have a more robust and compassionate social network, or even just systems out there that are able to accommodate without being put out to have to do so,
Hmm.
is a very capitalist way of looking at things. It might cost us money to, quote, put up with you. So you need to fix it. The problem then has to go back onto you, because to have a support network would be counterintuitive to a profit margin.
Totally.
And I know that might be a wide reach, but this does come up a lot for me. It's like, well, hold on a minute. You're still implying that everything is individualist. I do believe that there is an individualized amount of like how things work in it. It is nuanced, and it does rotate around the factors of needs and so forth of the individual. But yeah, like when you come up against one of these, quote, limitations, I've recognized it. I've owned my limitation. Now what? Do I have to fix it? Like you're saying before, am I now like, so
And who gets
I
to decide what fixed looks like?
exactly. So I have accepted the limitation that I'm shit at math. So do I now have to go and get every tutor on the planet and every textbook out there and get better at math because I have to own it? Like, at what point does that become remotely relevant to my life?
But he
So
may he may pivot to that.
I hope
Um,
he does. Let's see if he pivots. Man, yeah, that little segment got me a little squirrely.
oh
I gotta
yeah,
say.
yeah. I told you this was a little bit spicy. Like this is a man that I have a tremendous amount of respect for. Like his
Yeah, that's what I was thinking of.
work has both underpinned a lot of my own education, and whether I received it from other sources or not because of how influential he is in the field. But also like his communication, through videos and whatnot has been, yeah, I remember like, it was watching one of his videos that I really made the transition into like, okay, this is something that I need to treat seriously and, could be a meaningful explanation that could move the ball forward for me and has tremendously in my life, embracing it. So it was really, you know, um, they say you shouldn't meet your heroes. Um, I wouldn't say that this, soured the relationship, but it did remind me that just like, discovering that my dad was fallible, that
Yeah,
even people that I deeply respect don't always have the best takes. And I think that it's meaningful and valuable to like, be in conversation about the things that we are hoping to get and derive from this sort of content. Yeah, we've got maybe 6 minutes of it left. I'm probably going to do that in two chunks.
okay.
So get your notepad out. Here we go. A little bit of this action, and then click that button, and then we're back over here, and the closed captions are on. All right.
Next up, things I want you to stop doing. Stop deluding yourself into thinking there's nothing wrong. Oh, ADHD is just part of the spectrum of normal, everyday, typical variation, and therefore there's nothing to see here, right? Well,
all
if
of
that were the case, why are people with ADHD 5 times more likely to die by midlife? Why do they have 2 to 3 to 4 times more accidental injuries, more severe injuries? Why are they more prone to a variety of adverse health outcomes that lead to their lifespan being shortened by an average of about 12 to 13 years over time? Some variation, okay? So, this is what I mean by delusional thinking. There's nothing wrong with me. I'm just part of typical variation. Leave me alone. Okay, we will. And you're going to continue to struggle in life. Next, and my brother was very good at this. Stop blaming the people around you for what is happening to you, for your own choices, actions, and the consequences of those actions. He was really good at blaming each of his 3 wives, his employers. He was in rock music a lot. He played in many bands. They often broke up. The half-life of a rock band, as you know, is pretty short. And consequently, it was always the other people in the band. It was always the promoter. It was always the sponsor of the job he was at. It was never him. And as a result, it was very hard for him to seek treatment. In fact, at one point, he was court ordered into treatment for vagrancy, for living in a VW van on a beach in Florida when his wife kicked him out of the house yet again. But it was, of course, all her fault, right? So please stop blaming the people around you. You need to own this and the consequences of it. It's not their fault. Stop blaming the world at large for not being so accommodative to your ADHD. Oh, well, the school system should be adjusted. Oh, I should get these accommodations. You owe me. My employer owes me accommodations. Nobody owes you squat. Your existence by itself is not a claim on other people helping you. Owning your ADHD means it's incumbent on me to pursue those changes. I'm not saying that we can't advocate for change in the world and make the world more accepting, but that's not the problem. The problem is blaming others and the world for where you find yourself to be and the consequences of all the choices that you have made up to this point. So no one is compelled to help you. And when they do, say thank you. But more importantly, seek it out on your own, get the treatment you need, and don't blame others. And don't blame society. So it is incumbent on.
Oh boy.
I'm still writing notes. That
Yeah.
health. Hold on.
I do have, even as triggering as a lot of that was for me, I do have some empathy for where he's coming from. Like there is a strong vibe for me of he's not saying these things because he thinks that these are dirt bags. Like I've heard him talk in a bunch of other circumstances about his brother, and he loved his brother. There's even some admiration in the way that he describes his brother in other contexts. He's told stories in other contexts about the reason that he got into the research that he does, being adjacent to his experience being a sibling of an ADHD brother. Um, so it's really interesting to me to hear him use this language. I'm very mindful in this circumstance of the ways in which my sister's experience growing up with me being an ADHD child, first undiagnosed, then later diagnosed, really colored her experience growing up. And I'm wondering, as a teen or an adolescent, like what his experience was living with his brother and like what that feedback loop was like, how much of his brother's experience was related just to his ADHD and how much of it was related to the sort of interplay between like the mutual suffering that's going on there. I do get a sense that even in the extremes of what feel like really unfair critiques, it is coming from a perspective of he wants the best for people that are suffering in these ways. It does feel deeply unfair the way that he's pursuing it. But doing my best to be a steel manning person. Steel manning is when rather
Yeah.
than straw manning someone else's argument. I try to like look at it in the
No,
best possible light. I do think he's coming from a place of good intentions. I have a lot of critique about the way those intentions are manifesting. And I made my notes, but tell me
uh,
some of your thoughts.
well, I I I had a lot of problems with this, not necessarily because of any sort of like reactive trigger, but most, and I appreciate you because I don't have a lot of his backstory, so I appreciate you filling in a few gaps. This The first thing I thought to myself was, aren't you just blaming your brother? Like you're literally performing the precise thing you're telling people not to do. You're saying that your brother owed it to you to treat his ADHD and then telling me that nobody
Right.
owed you.
He
This,
says, it's not, your existence is not an obligation on the part of other people, which does not acknowledge the idea that then why is my disruption an obligation to other people?
exactly. Yeah, like, and that, I mean, first of all, my first note was no, it's actually called magical thinking, not delusional thinking. Magical thinking being that there is a space and time that you can get to by bypassing the hard work. So I get what I hear in his voice is frustration that would lead me to say, sounds like you have a resentment towards your brother and how he lived his life that has nothing to do with ADHD.
Hmm.
That sounds like a projection of your optimized situation for him that you are projecting onto him and making conclusions and assumptions
Certainly raises that question. Yeah.
without taking into account the fact that maybe there was more at play in his relationships with his work and with his partners. It's not a blame situation. I get, because I know I personally projected a lot of my insecurities onto workplaces and other people and made it all about them because I didn't stay on my side of the street.
Hmm.
I get that. To say stop blaming other people, nobody owes you anything, is damaging. Yes, they do. For the same reason that you are responsible for whatever, so are they. Like, yes,
I think there's a dichotomy there. It's like just a like a fairness thing. Like either everybody owes everybody or nobody owes nobody. Like pick one.
no, I think that it's, again, it's not that black and white. It's not even about owing. If you
Well,
have an
he's speaking
expect,
from a perspective of obligation. He's describing the obligation of ADHD people to their greater
yeah,
context.
but it's nobody else's obligation, responsibility, or anything to do anything for you,
Right.
which
That's what I'm
is,
talking about. It's
yeah,
either
yeah, yeah.
both or neither.
Right, right, exactly. And I just, it just felt like he's got a lot of resentment and he's just projecting a whole bunch of stuff because, like,
That's a candidate explanation.
you
It's
know, like, I don't get why it is important to consistently reduce it to your personal requirements. Like, I don't know. I guess it's like if you have an expectation, consciously or subconsciously, to have other people meet you and take care of you and validate you, that doesn't even speak to ADHD. That's not an ADHD problem. That would be an
it,
insecure attachment.
I'm not sure that the things that he's articulating here that don't make sense to us in a societal fairness sense are a representation of him having a thorough philosophical perspective on the way a society should be. I think what I'm hearing is that he has the sensation of here's the tough talk. I'm giving tough love. I'm saying the hard thing that the people need to hear. And he's just saying it reflexively from this perspective, not because he like fully endorses like who owes whom what in society, but rather he really, really wants these people to stop suffering. And until they get it through their heads that they need to take that agency for themselves, it won't happen. Like that feels like where the thrust is coming from. And the lack of
Maybe
appropriate.
I think you're being I think you're being extremely kind to how his delivery is. And it's one of those
Well,
good intentions pave the road to hell kind of thing, right? Like you might
for
have that,
sure.
but why isn't he saying that? Like, why do I have to
For
infer?
sure. Like it deserves critique, even if it's unintended.
Yeah, and I don't know. I just
And there's things in here that like
there's just a lot of privilege baked into this.
there's no need for mockery, for example, like putting on a voice and being like, "Oh, there's nothing wrong with me." Like, why
Right.
communicate in that way? Who
That's what I'm
who
saying. Like
benefits from being ridiculed?
this feels like a resentful, belligerent attack, and it's not actually helpful in any way because he's not providing anything. He's just you need to this, you need
Yeah.
to that. Like I
I
don't
am persuaded that that's blindness and bias, not malice.
fair. I'm not saying that like, I mean, obviously he's not trying to be mean, but again, it's like I'm having to drift way too far out of what he is saying in order to make
Totally.
inferences back into what he's saying in order to soften the blow that he's basically just speaking from a place of myopic privilege and doesn't seem to understand the struggle of the thing that he's been researching his whole life. So, like,
It is kind of stark the missing empathy in his language given
yeah,
the
for sure.
structure of his life's work, you
It's
know?
like, it's literally
There's
something like, does he have it himself?
I
It's
mean,
making me wonder if
he
he's
comes
ever.
from a family that has it, and it is a deeply genetic thing.
And does he therefore project the resentment on himself for some unmanaged shit? Like, I guess I'm just thinking, like, this seems just awfully, I don't know. Let's keep watching.
Yeah,
This is
I'm gonna let
making
him
my
finish this
brain
time.
itch a
We've
lot.
got
I'm hoping that I resolve some of this total lack of empathy and compassion towards the circumstance. Yes. All
he's got 2.5 minutes left in I think
right, dude.
we can call
Own it.
it read. I
Own
think
your resentment,
all right,
dude.
Dr. Barkley, present us
Yeah.
with your wisdom.
You to adapt and adjust to the world as you find it. It's like playing golf. You play the course as it is and the ball as it lies. And you don't make up the rules as you go along. You don't move things around because now what you're saying is, I can't accept reality. I can't cope with that. So, yes, work to change the world where you can. But if the world isn't changing fast enough, part of that may be you. You're expecting way too much from others. Remember, they owe you nothing. So when they are helpful, be grateful. So, yes, as you become more effective and successful, you too can become an advocate to improve life circumstances, to make treatments more available for people with ADHD. But in the meantime, as they say, it is what it is. Learn to adapt, cope, accommodate, and negotiate your way through this world to a more successful outcome. Many people with ADHD have done this. Simone Biles and Michael Phelps in the case of athletics, Charlie Hull, Bubba Watson in the case of golfers. Many athletes have accommodated, accepted, and succeeded with their ADHD. We can also talk about musicians, actors, actresses. I mentioned Adam Levine, Justin Timberlake, many others who own their ADHD, deal with it, and go on to succeed with it and often in spite of it. So there are many good examples out there of success stories. Just Google ADHD success stories and you will see what I mean. But the point of all of this is one of the underlying themes of these stories was ownership. It's mine This is who I am. This is the way it is. Now let's deal with this. All right, everybody. Thanks for joining me for this particular commentary. Please leave a comment.
We don't have to listen to the sign off. Um, yeah, the thing that like both really bothers me about the delivery and seems to give me this capacity to, interpret what he's trying to do as opposed to succeeding in doing, is this ambiguity between the points around agency and the points around obligation.
Yeah, yeah,
Like I fully agree with him that, I mean, from a very personal perspective, the most meaningful changes in my life were the ones where I said, it doesn't matter why this is happening. What matters is that it is happening, and I'm either going to do something about it or I'm not.
right,
Like developing that capacity to take the decision into myself and do what I could to manifest something different. Like there's foundational, absolutely
oh,
pivotal,
for sure.
life-changing shit for me. And I think that that's his goal. But then he goes on to use language like, not only are you solely responsible for it, but that's how it should be.
Yeah.
Like, and that doesn't
Um,
make any sense to me. Like,
I, I, I don't. I basically can say that that is the first video about ADHD that I've ever watched that I got nothing out of.
mm,
Like, I guess other than seeing,
that's spicy.
well, like, okay, other than recognizing the words coming out of his mouth and being able to create in my own mind some counterpoints and some focal points that definitely came from it. I mean, as a vehicle to other wider and more compassionate conversations, I can see that being useful. Like we're having a good conversation about it. But as
Right.
far as the content in that, there's nothing useful there. Like the conversation about ADHD and, becoming capable of taking inventory of your own situation and, finding accountability and responsibility where it lies has nothing to do with ADHD. I mean, it does in part, but there's so much more at play. I mean, the only thing I wrote down here was, do you know, sir, anyone in your life who just became content and fulfilled without having the quotient of success attached? Like
Hmm.
every example. Therefore, so the fact that I'm not a professional golfer is because I don't own my ADHD. The fact that I'm not a renowned something is because I don't own my ADHD. Like, what are you talking about? Like, these examples, it's like, okay, the thing that is most useful in the acronym based recovery program that I am a part of uh, is that the language is always to be from an experiential based tone. Speak to your own experience, your own revelations, your own understandings. This was a finger point
Hmm.
using examples that are not relevant to the world at large. All you're doing is going back to that. If only you could do better, you'd be better. Why can't you just blah? You can't be good at whatever unless you own. It's just like, dude, you're basically just going back and saying the most damaging things you can ever say to somebody with ADHD. If only you could just keep a day planner handy, you'd be Simone Biles.
Yeah, the choice to use
Always,
Olympians,
yeah, it's just that myopic, privileged.
although I did appreciate that he's like Michael Phelps and Simone Biles and other athletes. There's even a bunch of golfers. I like the acknowledgement that golfers are not athletes. That was
Exactly. Yeah, there you go. So other than learning that golfers are not athletes, I'm not sure I learned much from this.
Yeah.
Um, because it's like it just at the end of the day, in order to unpack anything from that isn't actually damaging to neurodivergence writ large, I have to step wide of what he's saying.
Yeah.
I have to take too much of a sieve to that to get any qualitative assessment out of it. It just sounds like a resentful rant against people who have ADHD.
There's a there's an evolutionary aspect to this for me. Like I can pretty easily look at my parents and their family context and be like, they did a better job. Simultaneously, I can point at ways in which they did not serve me. And I can point at things that I have done that I think were better. And
Right.
I can also point at shortcomings. It feels like, there's a ratcheting, trying attempted, improvement or combating entropy. And there's an aspect of this for me in this, like listening to the uncle that I respect at Thanksgiving saying some shit that is like, dude, what the fuck? Like one
Right.
of the things that was really profound for me in learning about ADHD and um, uh, particularly, researching some of the things that he's done is that there is a pretty famous, I think it's 2001 consensus statement on ADHD, which is signed by like 50 researchers and professionals in the ADHD sphere saying, look, the media is getting this wrong. This is not fake. There's not any academic ambiguity. This exists. It is problematic. It harms people in these ways. It was a really profound and interesting way of communicating to the world at large that the public and generalized perception of ADHD was problematic and it needed to evolve in some very factual and scientific ways. And that is a little bit ironic to me because of the ways in which in this video it feels like there's a lot of myth being endorsed. There's a lot of um, uh, you were describing it as personal injury, like emotional injury related to his own experiences with ADHD and his family. That may or may not be an accurate characterization, but it did feel much more grievance oriented and much less fact
Yeah.
derived. Now, this is an off the cuff, video on his channel as opposed to like a well thought out statement that a bunch of people reviewed and signed,
That
but
more
still, there's a
worrying?
responsibility. What's that?
Isn't that a little more worrying? Like when you're
Yeah.
handed the mic and told to speak off cuff and you contradict your life's work in one fell swoop. Like
Like
I'm just like,
it's
I'm
problematic.
not going to judge the guy and everything he's ever said based off of this. I mean, looking at it just as a video, if I saying I never heard, I mean, and it is the guy I was thinking of. So it's like if I had never heard another word this guy had ever spoken, and I had no exterior content, just looking solely
Yeah.
at this video, my response would be, this has nothing to do with ADHD. You sound like you have a lot of resentment you need to deal with.
Yeah.
And I think that it would be well for you to stay in your lane.
It could be both, like I mean, like
I just don't know, again, like without having to contextualize it against his body of work, if I don't know anything about that, I would not see this as a video that was made by somebody who has it or really understood it.
yeah.
And that to me is problematic because how are you a practitioner if, when given the mic and speak off the cuff, you could be so reductive?
It is frustrating. It is frustrating. I mean,
And
it's
it's
stuck in my craw. I listened to it in July and I was like, I've been thinking
yeah,
for
yeah.
months about,
There's a more dangerous undertone that is the same sort of drivel that came up with the law of attraction. when that whole, I don't know if you're familiar with that. It's the law of attraction was something that it got brought into the public space through the book The Secret
Oh,
and
sure,
the
sure, sure. Yeah.
documentary that went along with
That's
it.
some extremely dangerous, self-serving nonsense.
It's the idea that you can just simply thought your way out of a problem, or more importantly, quote, manifest simply by thinking better or differently some sort of like thing in your life. Like success will come to you if you think harder about your ADHD.
That,
Like,
yeah.
and I'm like, that's not true. There's so much more at play. And I mean, Carl Jung never mentioned ADHD once, but he hit all of those bullet points.
I feel like with the law of attraction, it's not exclusively that it's not true, it's that it's incomplete. Like it is absolutely true that um, something that we don't believe is possible is functionally impossible. We're not going to try to do it. So belief, like creating and manifesting a certain set of thoughts, has an effect. It's just not the whole fucking story.
Right, but I mean, the problem with the law of attraction is it's trying to glamorize positive thinking. Like yes, having a more positive perspective on things and being more open-minded to the unknown and things that you don't know to be likelihood. If you can, kind of put your anxiety to the side and be more open and receptive, yeah, sure. You can therefore open channels that you may have limited yourself from, or things might become available. But the law of attraction implies that all you have to do is think about it real hard and it will literally appear in your life.
Yeah.
That
And
sidestep.
that if you fail to do so, it's your responsibility for
Yes.
having thought so
Yes.
negative.
And it's like that's kind of sidesteps a lot of hard work in the in
Totally.
between and strips the individual of the agency of their own self betterment. Like you're not actually in charge of the fact that you just made all these decisions about your life. Like the funny the biggest satire, the funniest satire on the whole law of attraction thing I ever saw was in the show The IT Crowd, where the boss is like, "It works, Jen. I drew a picture of a helicopter and I threw it out the window and then I went and bought one. It works."
That's awesome.
And it's just like, yeah, because that's basically what you're saying. I thought about this really cool thing I wanted. So I literally did the work to get it. All I had to do was think about it. No, idiot. You had an idea and you followed through. That's not the law of attraction. It's not some big mystic curiosity. It's not that complicated. Like there's a gritty humanistic quality to all of this that just gets ignored.
Hmm.
And I think that this is equally as damaging because the
It
the
does
the
feel damaging.
yet the counterpoint to this is, so you're saying that if I don't own my ADHD, my life is a negative mess. So I have to be responsible. I mean, can you imagine telling somebody with ADHD, you alone are responsible for all the
This
bad shit in your life? Like,
there's a
what the,
shocking lack of empathy or seeming lack of empathy in the
yeah,
delivery.
and I just think, like, what the fuck is wrong with you, dude? You would never say that to a patient.
You shouldn't.
Yeah, I was like, I hope you never say these kind of things to patients. And more importantly, check your fucking privilege, man. Like you have no idea, like you were talking about, you don't know what the accessibility level is of people, the awareness level is of people. Like I get where you're kind of coming from, like, you can't unknow something, right? So once you do know that there is a pain point in your life and you don't address it and it is causing problems, yeah, that is kind of on you. Like it is a responsibility of each individual to check on in with themselves and to become aware of who they are at their core, to learn to unpack the self, separate it from ego, et cetera, et cetera. Like, yeah, these are super
I
important parts of
even
self.
then, like,
What
when
does
am
that
I
have to
ever in
do
a
with it?
position where I can adequately evaluate if somebody has been able to go through that process? Like, even if that is true, the
Right,
implication is that, me as a member of society can look at you and hold you accountable to it. And that's not true.
right, exactly. And it's like, and it's not the whole picture. It's not about ADHD. Nothing he's talking about is actually about
Well, it's both
he,
about ADHD
yeah,
and
he's
not.
using it as a jumping point for self-awareness. Like
Hmm.
using the term ADHD, I could replace that with depression. I could replace that with like anger issues. I could replace that with insecure attachment style. Like I could pick anything that creates a dissonance between the self and the other and put it in the title. And that still would have made sense as a video supporting capitalist drives to wealth and success. Like I seriously,
It got you riled up, man.
I just it does, because if there's one thing that all of this work I'm doing is pointing me towards is it ain't that fucking simple. It's not about success. And yes, society is responsible for society. Like there is a level of cooperation here. It is not a hyper
Right,
individualized focus. Like there's just not, I don't know. Yeah, it really does. It does. It riles me out when people are so reductive,
for sure.
but also like play themselves up as the gatekeepers to all knowledge. Like, don't speak to me like, don't speak to anybody like that.
It
Like,
can
speak
come
from your
across as
own,
condescending.
yeah, don't speak from your own experience. Like, if he had talked about his brother from a more complex, robust, and compassionate lens, instead of just using all of the negative traits as somehow an implication of how he didn't try hard enough, which is absolutely the worst thing you can say about someone with ADHD. Like, yeah, it just, I don't know. I think that I've touched on all the my takeaways, and I think the biggest takeaway here is what the hell does that have to do with anything? You
Well, let's
know,
tie it up then. I appreciate you going through this exercise with me. I found that
actually,
to be
I
pretty
enjoyed it. It
interesting.
keeps us focused. Did.
Yeah, yeah. All right. I'm gonna kill the recording then.